gentlemen. Good morning. Some of you, welcome back again. Now, I have great pleasure, without much ado, I'm going into the introduction. We have great pleasure to introduce to you Dr. Sladjana Velkov, who is an MD. She was born in Macedonia. She was raised in Serbia, and she has worked as a medical doctor for United Nations and also as an emergency doctor in Kuwait. And now she is giving presentations and doing jobs. Her career now is a medical development manager. She has undertaken that mission to educate people about healthy life, and you know how specifically important it is in the modern life. Without much ado, let's put our hands together to welcome. Where is she now? Ready?
I would just add one thing to this introduction, that I don't earn money from this, what I do. So I don't earn any money. Yeah. Okay. So, yeah, she already did. You know, I wanted to become doctor because I wanted to help people. This was my reason. So, this is Hippocratic Oath. I will apply for the benefit of the sick all measures that are required, and this is one of the measures, because I felt that people, they don't get enough information. So when I collect all pieces of the puzzle, I made a puzzle, and this is what we are going to share today. And you will be surprised. Please listen very carefully. I'm going to talk around 50 minutes, 50, and this can be life-saving information. So questions we'll have after the... This lecture is for educational purposes only. It is not meant to diagnose, treat, or prevent any disease. If you are ill, see your healthcare professional. We are going to talk today about what we actually eat, about meat, milk, water, enzymes, causes of and treatments of chronic diseases. Let's examine what is the source of life on this planet. You see, first source of life on this planet is the sun. You know, without the sun energy, there is no life on this planet. So, if you put a plant in a basement for 4 days in a dark, plant will die. After plants, all animals and people will die. So, sun is extremely important. This is first source. Second source are plants. This is actually first downgraded energy, sun energy. Second transformation happened in carnivores, which are plant eaters, and they consume the purest energy, sun energy. This is the purest transformed sun energy, and third transformation of sun energy happened in carnivores, which are meat eaters, and you all know that flesh of these meat eaters is acidic and is not suitable for human consumption, because they consume very dirty energy, downgraded energy. But not only that, we don't belong, people who eat meats, they don't belong only to this group of carnivores. They belong to the group of even worse group. So on the left side you see lion. Lion actually and eagle, they eat meat which is hot, which is full of enzymes, which is alive still. But hyena and vultures, these are the two animals which eat dead flesh. They come and they eat dead flesh which is decomposing already, which is old, is not alive. So, guess what? We humans who eat meat, we belong to this group of hyenas and vultures. Yeah. And you just compare lion, who is full of life because he eats energy in the meat, and hyena, look how she looks like. And we people who eat, that flesh, we belong to this group, and please pay attention. This is very important. We eat something what is decomposing and getting bad. Let's examine differences between plant and meat eaters. According to lower jaw, you can see that carnivores, meat eaters, they have vertical hinge, means they can open mouth up and down only. Why? Because they jump on the cow, they tear the meat, they swallow. What is happening with herbivores, like a camel, horse, cow, and humans, we have sliding jaw. Jaw can go left and right for grinding grains. Okay. So also about teeth. Carnivores, they have fang overlap mandibular. They have very sharp teeth, instead of molars, and we have molars for grains and vegetables. So, just for comparison, you imagine, because we are made by God, to eat plants. Like imagine that we are in a nature, without any weapon to kill animals, like God didn't design a weapon together with us. Imagine that you jump on the cow and, to try to tear the meat from the cow. You cannot, because you're not designed by God to do this. This is not natural. And also, when you see the cow on the field, do you salivate like a wolf? No, because we are not designed for this. Wolf, when he sees the cow, he salivates because he's hungry. This is his food. And we don't salivate. We salivate on apples and on the... yes. Regarding acidity, carnivores, they have 20 times higher acidity than plant eaters. And in this, so they can digest meat. What is happening with the cat when she eats meat? She have immediately in the mouth, she have acidity, so she start digestion in the mouth. Okay? In stomach, they have 20 times higher acidity. They digest the meat, which is very hard to digest. What is happening with us? When we eat meat, we don't have acid in the mouth, and we have very small acidity in our stomach. So meat is not digesting. Meat is putrefying, means dissolving, getting bad actually. And because intestinal length in carnivores is very short, so they get out all this meat very quickly in a few hours. So because meat is poisonous, they don't become poisonous. Nature made this. But in our stomach and camel stomach, meat will stay for 3 days. Why? Because we have long intestines, and meat requires 3 days to pass through these intestines. So if you want to imagine what is happening in your stomach when you eat meat, just put a piece of meat on a kitchen table, on a room temperature, and see what is going to happen after 3 days. This is the same in your stomach. The same happens. So, all this sulfur and all this acid which is coming from the putrefying, we absorb in our body. These are poisons. What is in the meat you eat? Okay, let's see. If you eat meat, what is in the meat you can find in shops? First of all, you can. A scientist, Stanley Prusiner, he got Nobel Prize for discovering prions. Prions are infective proteins, and they cannot be killed on 1,000 degrees centigrade. So how actually, this is how cows got mad cow disease. Because they ate, I didn't explain how cows get fat actually. They collect dead animals, they cook them, they dry them, and they melt. So we call this animal flour or bone meat. So when cows consume this bone meat, they go to these prions, and they go to mad cow disease. You see, in the nature there is no mistake, because cows is designed to eat grass, and when they feed cow with the same species, with the meat, then they become sick. This is nature. So what happened in humans when they eat such a meat? They got Jacobs-Creutzfeldt disease, which is the same like mad cow disease but another name, and this is kind of dementia. Okay? So next thing, they feed cows with hormones. Why? To be profitable, to get big cows quickly. So, but what is happening with us when we eat such a meat? When you feed your children with those meat, then they got early puberty. 50 years house with hormones. Why? You know, to be profitable, to get, you know, big house quickly. So, but what is happening with us when we eat such a meat? When you feed your children with those meat, then they got early puberty. 50 years ago, children were getting puberty around 16, 17, which is normal because they are ready mentally and physically for the adult life. But nowadays, children get puberty around 10, 11. What are enzymes? We have three types of enzymes. First type of enzyme is enzymes from the food. Every food, living food, have their own enzymes. Second enzymes, the second group of enzymes are digestive enzymes from pancreas, from stomach, and these enzymes are actually just helping digestion. And third type of enzymes are metabolic enzymes. And metabolic enzymes, they are in the cells, in brain, kidney, heart, and they're fuel for the cell. So let's see what enzymes from the food do. Actually, all enzymes. Enzymes is taking piece of food, breaking piece of food into small parts which can be absorbed. And our body then absorbs these nutrients. What is happening if you don't have enough enzymes? All this unbroken food will stay in your gut and will feed, actually, will be base, foundation for fungus. You know, almost all people who eat cooked food and animal products, they have fungus because they feed fungus with this cooked food, with these huge molecules. Sources of enzymes, you have all uncooked food, fruits, vegetables, seeds, nuts. What cooked food does, this is very important to understand. Digestive leukocytosis. 1930s, Dr. Paul Kochakov from Lausanne, Switzerland, he did research, you know, because we have this problem. Digestive leukocytosis means when you eat food, immediately the level of white blood cells, leukocytes, is raising. And when we have leukocyte level rising, when we're sick, when we have infection, correct? So, he was, you know, to him something was strange there. You know, how comes that when we eat food, we get this digestive leukocytosis?
Cooked food.
So he was food, because that time they didn't know about. And then after research, you know, he was feeding patients with that type of food. And then when he started to feed people with uncooked food, raw food, he didn't have digestive leukocytosis. White blood cells were peaceful. So he was, from that time, we don't have digestive leukocytosis anymore, but we have pathological leukocytosis. Means that when you eat cooked food, you're in a pathological state. You're sick. So, and of course, this is suppressing the immune system because white blood cells are going to fight cooked food, and you don't have enough enzymes to allow it to fight another problems. Cooked destroys proteins. 50% of proteins are destroyed by cooking, vitamins, minerals, chlorophyll, and damages fats. Pesticides become more toxic. Oxygen is lost, free radicals are formed, and fibers are destroyed by cooking. Quickly ferments, cooked food quickly ferments and putrefy in the intestinal tract, and this is why we have body odor and halitosis, which means bad breath. Otherwise, we will not have. Is a good soil for bacterial growth. We already discussed. Arteries, nerves, spinal cord, and the tissue become hardened, prematurely old. So we get, we get old before. Yes. Thank you. Decrease alertness, efficiency, productivity, and causes allergies and obesity. How cooked food causes allergies? You know, when you cook your food, then by cooking, you don't have anymore these small molecules which are made by nature. You have big molecules, like in coagulation in proteins. they stick together. And the body cannot recognize them because they are big, they are not, because we are natural, and cooked food is not anymore natural because it's changed. So immediately body recognizes this big molecule like something foreign. It's not what we find in the nature, and produce antibodies to fight. And this producement of antibodies is actually allergy. And how cooked food causes obesity? You know, when you eat cooked food, body doesn't get any nutrition, correct? Everything, almost everything is killed. All enzymes are killed. So because of this, body immediately after your lunch start to think about next supply, next meal, because there is nothing in the body. So you constantly eat, you know, and this constant eating, pouring calories in your body and no nutrition is causing obesity. You know, people ask me how I can get all nutrition from raw food, you know. So, but body will soon adjust to this another situation because body is getting enough nutrition and doesn't require more. Okay? Raw food. What you get from raw food? Raw food is full with enzymes, vitamins, minerals, proteins, chlorophyll, and good fat. Quickly and easily is digested. There is no putrefaction, means no body odor. No tired feelings after meal. You don't feel that you want to sleep. You want to run after your meal when you eat raw food. And you don't sleep, I mean you sleep like 5-6 hours maximum. Metabolism, efficiency, and ability to absorb increases because your guts change completely. No diseases. And you have peace of mind because you know that you cannot get any disease. Raw food boosts life in you, more strength, energy, and stamina. You know when you put something what is dead in your body, you know, killed, something what is killed, you cannot expect to boost life in your body. But when you put something what is life in your body, this will boost life. Let's compare our body with a car. One car is designed to run 300,000 kilometers on a gas, for example. But if you put in the same car diesel, then car will run 100,000 kilometers because you put something what is too oily. It's the same with our body. You know, when you put something what is too oily, and this is animal fat, then you run 3 times less. You know. Scientists, they said, they examined people who live long, who lived 120 years of age. They researched that topic, and they said that every one of us is capable to live without any disease up to 120. But because of food we eat and lifestyle we live much shorter. There are people who can live more than 100, and one of this group of people are Hunzas. These are people who live on Himalayas, on a border between Pakistan and Afghanistan. People who eat raw food and dried food. They don't have electricity, they don't have refrigerators, they dry their food and they eat their enzymes, because in dry food you also have enzymes. And they eat a little bit of meat, but they eat meat just for the feast. And this meat which they get, you know, it's from the Himalayas. They're not from the farms. They don't have hormones and this bad stuff. And they don't have money. They don't have jobs. They're very happy people. And there is something very important. Dr. Dean Ornish from Institute in California, he did research and he put a group of people on vegetarian diet, some exercises, some meditation, and what he found, they get well from all these diseases they had, but not only that. 500 genes were changed, including 48 that were turned on and 453 genes were turned off. This means that hereditary factor is not anymore valid. Means that you can switch off any gene you want just by 3 months eating and living by following the God's law, you know. And what he said, in just 3 months I can change hundreds of my genes simply by changing what I eat and how I live. That's pretty exciting. This is one of the raw food map pyramids. And what you can see that we have the green vegetables, fruits, sprouts, nuts, and seeds. But on the bottom, it's water. First, we have to take water. Why water is so important? Because we are made by 75% of our body is water, and 85% of our brain is water. So when you don't have enough water, let's examine how we can improve almost all heart problems and high blood pressure. Instead of getting pills to decrease level, diuretics to decrease level of liquid in your body, you actually need more liquid. Why? Because when we don't have enough liquid in the body, our body, in order to supply all body with the blood, because there is not enough blood in the body, then our body will constrict blood vessels to get everywhere. So this constriction and also thick blood, because we don't have enough liquid, will actually cause high blood pressure and all other heart problems. How you can improve your back pain, let's say, because there is a disc, very soft disc, which is mainly made of liquid between two vertebrae in your spine. Okay, so when you don't have enough water, this disc will shrink and will slip between two vertebrae and will press the nerve, and you get a pain. When you drink more water, this disc will plump, come into the place, and no pain. And also cholesterol, you can decrease cholesterol. How? You know, cholesterol is natural product of the body. So cholesterol is produced by liver, and we need cholesterol. Cholesterol is essential for producing hormones. And not only that, wall of the cell is made by cholesterol. So when you don't have enough liquid in the body, then the body will open a little bit of pores on the cell wall and a liquid leak out of the cell to supply body with the liquid. So in order to stop this, because our body is shrinking, cell is suffering, so in order to stop this process, body is producing more cholesterol to build the wall, to stop leaking of the liquid. So drink more water and decrease your cholesterol. Health myths. People ask me, what about soy? Shall we? No, soy is actually dangerous food. Soy have hormones, huge amount of hormones which can actually cause early puberty if you give your child to eat anything from soy. But also in adults, soy can cause breast and prostate cancer, and also very often soy is a cause of hypothyroidism. By the way, 99% of soy is genetically modified, and it's very dangerous to eat anything what is genetically modified. If you can get some fermented soy, non-genetically modified, like people in China, they eat only fermented soy, like Nisu, like tempeh, then it's okay. And amino acids. We have all amino acids in plant food. And we are also able to store amino acids in our body and to combine them. So in a few days, if you eat today some food and after 3 days your body will combine these amino acids. Vitamin B12. This is really health myth, big health myth. They always say that vitamin B12 you get only from animal products. This is not true. Because we don't find vitamin B12 in animal products nor in plant products. Vitamin B12 is produced by microorganisms. Small microorganisms who live, like all other animals, which are plant eaters, who lives in our guts, in nasopharyngeal passages, in our mouth. And we have enough. I always check my vitamin B12 level, and it's excellent, and I never take my supplements of vitamin B12. And also genetically modified food, be aware. What about water? First and the most dangerous thing you have to be aware is fluoride. Fluoride is neurotoxin, and it's rat poison. So, you know, fluoride was used in the Nazi camps and the Russian gulags to decrease a number of guards. They decreased from 100 to 20. How? Because prisoners, they start to obey. When they get fluoride, they obey. They don't want to escape. They just do whatever they tell them. So, and fluoride was introduced into the tap water, bottled water, toothpaste after the Second World War in America, Canada, South Africa, Australia, New Zealand. Most European countries, they refuse fluoridation because they know this is extremely high toxin. So what actually fluoride is doing? You see, when they introduced water, fluoride in the water, they said that they had excused that actually fluoride is good for the teeth, for prevention. But this is disproven, you know. Even in a Scientific American issue, January 2008, there is an scientific article about actually that fluoride is causing fluorosis. This is a disease of the teeth, you know, not protecting but causing a disease. And not only that, the biggest consequence of fluoridation of water is calcification of the pineal gland. Pineal gland is the most important gland in our body, and it's producing hormone melatonin. If you don't, when the gland is calcified, you don't have enough melatonin, then you get depression and lethargy, and you don't want to live. Okay? And you cannot perform any job, you know, with your full capacity. So also, fluoride is causing brain holes in a white matter and decreasing IQ of our children. Infertility too. Bones, you can see on the picture, spine, you know, on the left side is normal spine, on the right side is spine which is exposed to fluoride, and also asthma. And also fluoride is added in the drugs, because only fluoride can pass brain membrane, and other chemicals they cannot. So they combine with fluoride so the drug can pass brain membrane. First sign of toxicity by fluoride are achy joints, fatigue, and memory problems. Okay? How you can get rid of fluoride in the water? You can buy some unfluoridated water, which you cannot find easily here, but there is also reverse osmosis filter, and you can buy it in the major cities, and also in Khobar you can find a shop with a reverse osmosis filter, and this is the only filter can remove fluoride from the water. What other dangers we have in food? Aspartame. Aspartame is artificial sweetener, and we have in a huge amount, especially in low sugar food, which you consume, you know, almost every day if you eat industrial packed food. So artificial aspartame is actually, you can find in soft drinks, drugs, and it's causing brain lesion, holes in the brain, and sclerosis multiplex. It is proven that one of the major reasons of sclerosis multiplex is aspartame. Second poison is MSG. MSG is monosodium glutamate, and this is actually a spice which they use to enhance the. Can we answer the question?
We call it as Ajinomoto.
Ah, okay. Okay, thank you. So it's extremely, extremely dangerous. You can see on the right picture how these white areas are actually dead brain. And it's completely destroying brain. And you need 75% of your brain to be destroyed to feel it. So never ever take this and usually you find in the restaurants, because if you put MSG in the waste, it will taste good. Okay, and it's causing learning problems, memory problems, numbness, blindness, depression, and so on. After eating food with MSG, you can feel cloudy, and I'm sure that you feel sometimes like this after eating your food in a restaurant, bad concentration, difficulty in logical thinking, and early signs. These are the early signs of MSG intoxication, but sometimes we have cardiac arrest. People can die from MSG. Microwave is killing your food, completely killing enzymes. So I'm glad you agree. And you don't have to have it in the house also because it's cooking your body too. This is strong radiation. You know, the problem with diseases is acid. You know, everything we eat like meat, milk, eggs, cooked food, and all industrial food, please pay attention, all industrial food, everything you buy in a box is very toxic, extremely toxic, and its product is acid. So acid is cause of almost all diseases. If you have alkaline blood, you cannot be sick literally from anything. So now our normal pH of the blood is 7.35 to 7.45. If you are in this, you're okay. If you're acidic, you have a problem. You have some disease, but it's not yet on the surface. How you can check your morning urine, your pH, you can check your morning pH urine, which has to be 6 to 6.5 with the pH strips you buy in pharmacy. There is a oncologist, university professor, Dr. Tullio Simoncini in Rome, Italy, and what he did, you know, he had his own clinic in Rome, and he is treating cancer with baking soda. For example, he treats colon cancer in 6 days with baking soda, just washing colon twice daily with solution of baking soda, because it is easy. Colon cancer is a fungus, and you just wash with the baking soda, because baking soda is the best medication for a fungus, and in 6 days people are going home. And I can provide you with his website and his videos, his lectures, and you can see with your own eyes. This is Dr. Noreen Day. She was chief of orthopedic surgery at San Francisco General Hospital and university professor, medical professor. She got breast cancer, she rejected all standard therapies, Western therapies, and she just ate food, raw food. She followed God's law, and she is now still healthy and alive 18 years after diagnosis with cancer. But not only that. We have another friend, our neighbor from Khobar, Renald, Canadian, French-Canadian. He did the same, you know. He got PSA, which is a marker which is indicating prostate cancer. So he's around 60s, and he had high blood pressure, cholesterol, and all this. You know, he was going through biopsy and starting to schedule operations and stuff. And he came one day to our doors, and he said, "Okay, what to do? Do you have something?" I told him, you know, what to do. I told him what I'm telling you now, and he said, this is too much. I'm a manager. I cannot do this. You know, this raw food, juicing salads. You know, it's too much." So he left. After 1 week, he came again, and from that day he followed. And just in 2.5 weeks, he got rid of high blood pressure, in 1 month of cholesterol, and in 3 months, his PSA was from 4.9 dropped to 3.5, and above 4 is dangerous. So he is not anymore sick, just with raw food. This is important to understand. Causes of almost all chronic diseases. There are 2 causes only. First is nutrition deficiency. Because we don't eat raw food, raw vegetables and fruits, we don't get enough nutrition. So this is one thing, and second thing is toxicity. You put so much toxins into your body, and the body cannot perform its normal, natural function. And what are the treatments of almost all diseases? Natural juices. We said that the first cause of diseases is not enough nutrition. It means we have to flood our body with juices to get more nutrition. And but raw juices, squeezed juices, fresh juices. And second treatment is detoxification, means enema, washing of the colon. Why is this important? You know, when people get cancer, for example, they get on a good diet, and really good, doing good, but all these toxins, all this cancer which is digesting from raw food, because raw enzymes are digesting cancer, and cancer is getting out through our colon. But these toxins are again absorbed through the colon and getting into his blood. So he killed himself with these toxins. So this is important in really severely ill people to, in the same time when they are going through juicing and good diet, to wash their colon, because all these toxins are accumulating there. The effect of bad food. Many people have, you know, on the left side is a normal colon, on the right side we have damaged colon. Many people have damaged colon. Why? Because all this cooked food and these poisons, they cause inflammation. Inflammation means that our colon is swollen. So when colon is swollen, then the walls touch each other, and you have, you know, these constrictions and problem. And also, because we have so much waste in our colon, then colon is dropping down and cannot really clean very nicely. So cleaning of the colon is very important. Sorry? Okay. You can prevent and treat cancer, sclerosis multiplex, fibromyalgia, diabetes type 1 and 2, atherosclerosis, high blood pressure, skin problems, acne, neurodegenerative diseases, inflammatory diseases, vision problems, and many others. So just to tell you that Western medicine have actually 3 types of treatments, let's say for cancer. We have chemo, radio, and operations. Okay? So chemo is it's killing bone marrow. And if you give a chemo to healthy person, what will happen with this healthy person? Will become sick. So we give to sick person and we expect to become well. You know, you kill bone marrow and you kill also some malignant cells. But next time when malignant cells start to multiply again, there is no immune system to fight back. And also about radiation, about radio. You know, this is million dose, higher dose than X-ray. So when you go take your X-ray, they tell you don't take your X-ray, you can cause a cancer. But when you have a cancer, they tell you take a million dose higher. You know, so there is no common sense. You know, and also about surgery. Surgery is just spreading malignant cells around, and biopsy too with needles and knives. And we don't, you know, cancer, when we have too much toxins in the body, then body to prevent, you know, intoxication will form the baskets. And actually tumors are the baskets. So body, to protect himself, will put all these toxins into the baskets. Means when somebody have a cancer, blood is overloaded with toxin. And better we do some cleaning instead of just cutting, you know. And very important to say, when you're sick and you go to the doctor to get your medications, you know, but it's important to understand that medications has nothing to do with your recovery. When you recover and you think that you recover because of medications, no. Because, you know, your body can recover, you know, without any medication. Medication is just masking the symptom and it's not treating the cause. You know, fever is just a symptom. Coughing is just a symptom. And bacteria are friendly to us. Bacteria are not causes of diseases. Bacteria are friendly and they come to our body when we have toxins, to eat the toxic waste. You know, bacteria are helping us. And we kill with antibiotics bacteria and we actually cause more problems. So instead of killing bacteria, you just clean your body and start eating good food, raw food, and you will actually, in this way, get in 1 or 2 days well, instead of on 1 week on antibiotics. And my recommendations, eat mostly raw food, avoid all animal products, drink plenty of clean water, breathe deeply. Very important to breathe deeply because this is also a detox program, and there is one course, Art of Breathing course, which is excellent course for breathing, and I really recommend highly. Follow the sun cycle means sleep when it's dark. you know, from 10 p.m. to 2 a.m., you know, we produce melatonin, which is a very important hormone, cancer-fighting hormone. And my recommendations: eat mostly raw food, avoid all animal products, drink plenty of clean water, breathe deeply. Very important to breathe deeply, because this is also detox program, and there is one course, Art of Living course, which is excellent course for breathing, and I really recommend highly. Follow the sun cycle means sleep when it's dark. You know, from 10 p.m. to 2 a.m., you know, we produce melatonin, which is a very important hormone, cancer-fighting hormone, and it's very important to sleep at that time, and be outdoor and exercise. Thank you. We can start questions, but we will just play 3 minutes, one video. Yes? Yes?
Can I ask?
Yes.
Video. Let us the video.
No problem. Okay.
Heart attacks, certain cancers, osteoporosis, diabetes. The major diseases of our society may be caused in part by what we eat. One of the physicians who helped me to understand why is Dr. Michael Clapper.
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery, for coronary artery bypass surgery, in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, "Mr. Phillips, did you eat before you came to the hospital tonight?" He said, "Yes." I said, "What did you have?" He said, "I had a cheeseburger and a milkshake." And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. Well, 30, 40, 50 years of keeping your blood very fatty creates changes in the blood vessels that are very dangerous.
Over the years, arteries can become clogged with fatty material. Then a blood clot can form, blocking the blood flow completely. If the artery leads to the heart, the lack of oxygen can cause heart muscle to die. That's a heart attack. If the clogged artery leads to the brain, the patient has a stroke.
The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis. You know, if you were to die of a heart attack,
Yes.
and it's the most common cause of death in the country today.
My question is about honey. You have not mentioned the honey.
Yeah, organic honey.
With the good side or
Yes, it is on the good side.
olive oil?
Olive oil, cold pressed oils, coconut oil. Oils are very important. They lubricate our joints, but not animal oils. Good oil you can find in coconut, in olives, in avocado, and they're but please use cold pressed olives. Coconut oil and olive oil for me is the best. And your question was
About
honey. Honey, organic honey means not processed. Okay, you can use instead of sugar. So when you make your juices or smoothies, like you blend, your spinach. If you want to get, for example, you go to the gym, instead of taking all these poisons from the boxes, you just soak your almonds in the evening, wash them in the morning, put in a blender, put spinach, raw spinach, put some broccoli, which is full of proteins or magnesium or calcium, put some flax seeds, put some banana for a good taste, put some dates. I usually use dates, but you can put also honey instead of sugar, and you don't use sugar at all. Yes?
Excuse me.
Yes.
For the fruits which is available nowadays, which is coming from America,
Yes.
Chile, it's already 6 months old.
Yes, I know.
Recommend
Yeah.
this.
You know, all these fruits, yes. First of all, I say we can do what is the best in the certain circumstances. Take what is less evil. So it's less evil to take this apple than other. But, you know, usually because pesticides are full they're acidic. So in order to neutralize them, we need baking soda. Soak your fruits before consumption in the water with 2 spoons of baking soda, and you will neutralize some of pesticides. It's not the best, but you always look for organic. There is veterinary organic shop, there is Katif shop. Katif vegetable market is excellent Thursday morning. Really, you can find the best carrots in Khobar. Yes. Yes.
You talked about detoxification.
Yes.
How can we naturally detoxify our liver?
With juices. Liver. Liver, you know, I recommend coffee enemas, you know, washing the colon with the coffee solution, which I have on a handout, but now I don't have. Maybe I will leave my handout at the desk so people can, you know, pick it up. So I have 4 pages where I recommend what is good to eat, how to treat terminally ill people, and but how to treat liver, I also can, there is my mail you can get, and I will send you liver cleansing with simple apples and some, vinegar.
Yeah, you have suggested about the juices and raw juices.
Yeah.
But how a diabetic patient can take that?
Diabetic patient.
Yeah.
You know, diabetes, you can treat in months, or 2 or 3. I'm serious. You can even treat in a week or 2. It's possible to treat. You need to be completely on a raw. You know, if you are healthy, you can be 80% on a raw, 20% like me on some cooked food like baked potato, brown rice, some cooked vegetables, little bit. But for sick people, it's important to be 100% because they need all these enzymes. So what is
Diabetic patient.
diabetic? Yeah. So, but for diabetic people, you know, you just get rid of grapes, figs. These are no, and also decrease date. You know, 1 or half date is okay, or small piece of banana just to satisfy the taste. But avoid fruits. You know, eat vegetables. So you can find nuts, vegetables a lot.
Can you suggest that they can take carrot juice?
They can take, you know, but carrot juice have also carbohydrates, so a little bit less. Put more celery, put more green vegetables. These are the most important. Broccoli, cabbage, yes. No yogurt, this is milk product. Yes.
My first question is this. There was a recent news that there are some kind of toxins in cabbage that is dangerous.
Yes.
What's your opinion about this?
Yeah, you know, all these toxins, you know, instead, many of you have gardens. Instead of gardens with the grass, you know, just have small vegetable garden and put your vegetables in your backyard, you know. So you can have your tomato on just a small place. You can have your tomato, parsley, you know, few of them. But cabbage you can soak in a baking soda and on water to get rid of some poisons and go to Katif. No yogurt.
Yeah, we need to take more fruits. Some of the fruits causing cold, like apples, bananas,
Oranges.
What is with that?
If we take them,
Yeah.
some of us are getting cold and bring diseases.
From the apples.
From the apples or bananas, sometimes. Oranges,
Guava.
oranges.
Guava.
Yeah, infections, cold and...
You know, I checked up what you eat after your orange juice or before.
If you have a throat infection,
Yeah.
fever, for
Excellent,
they are saying
excellent question.
you have to give them antibiotics.
No.
There is no solution. There is no solution.
What no
The
solution?
doctor said you have to give them.
I'm a medical doctor. I don't give to my friends and my family. So why? My patient, I mean my friend Renald, he had a meeting in Kuwait. He said, I'm very ill, I have very high fever, what to do? I have a meeting tomorrow, I have to go. I said, don't eat anything, or if you eat something, be sure that everything is raw. And second thing, take, because you're acidic when you're sick, take in the morning 1 teaspoon with water, glass of water, baking soda, 1 teaspoon of baking soda before breakfast and in the evening for 2-3 days to alkalinize your body. He got rid of fever tomorrow. He went on a meeting and his friend who was sick, he got antibiotics and he was sick for a week or two. So you get rid in 1 day in a row because enzymes are going directly there where they are needed.
Ma'am, of that animals don't drink milk. What about cats and lions? Cats drink milk.
Who?
Cats.
Cats.
She feeds her babies by them.
Babies. Yes, all babies drink milk, but when babies have a teeth, they don't drink milk, they eat meat
So
and
it
bones.
is essential for the babies to take milk.
For babies.
No, I said babies, they have a milk. After they get the teeth, you know, they have to chew the food, not milk.
Natural milk, you mean, even for the people. For their babies, they should have natural milk, not?
Of course, mother's milk. Mother's milk, yeah. Yes.
Mother's milk up to age 2.
Oh, very important to say, after age of 3, you know, after age of 3, our bodies start to lose enzymes for digesting milk. So this is why you always have, you know, some bloating, some problems, some cramps because of this. You don't have enzymes to digest this.
Actually, I have a real story that based on the raw food.
Yes, good.
I have one of my friends who have come with this colon.
Yes.
And the doctor told him you know, he asked for colon. And the doctor told him that they have to cut the colon and make an opening over here. Otherwise, he will die. You know, ulcer. And then he said, well, what if you make an opening over here? Okay? He said, well, your life will be longer for 2 months or 3 months. He said, well, I will die anyway, so I will not do whatever it is. He went to another doctor and he told him the same. He gave him the answer. So after that, he just went into raw food after consultation, and he's now very, very
Yeah, I have also.
You suggested to take raw food, but we have the tendency of the combination, like we take a salad and then we go for the cooked food. Will that affect the digestive system, like you are taking raw food which will be easily digested? I'm not sure which will be easily digested and which will not be easily digested. We have a combination of raw food plus the cooked food.
Yeah.
Is it okay?
Very good question. Because, you know, when you have at least 51% of the meal raw food, then you're getting your enzymes to digest all this uncooked food. So it's not, you know, the ideal, of course, but 51% is the lower range, you know. So if you eat, put at least a little bit more of a raw food to be with your cooked meal, so, and eat it before.
Balanced diet.
Yes. Okay.
What about the refrigerated raw vegetables and...
refrigerated?
Yes.
Okay, you have to refrigerate them
so that we can also speak on this proudly. Let us try. Before concluding this, I would like to first of all thank the doctor for having valuable time coming all the way from I think you are here. Yes. So she has come back all the way, and then she was in fact I had discussing with her about all those things. Then she told me, why don't you arrange for a small presentation so that I can come and do it for you, and there's no problem. And I want more the people to follow this so that they can avoid. Mainly this course is only in nutshell, it is only to live on natural food and avoid mainly the medicines, and rather we should live long. That's only in nutshell. This is the only thing she wanted to tell, with a lot of examples and other things. This is really, we are grateful to you, madam, for this. And I should also here thank Mr. Renal Tremblay, who was the one, not only in every meeting, every day we meet, he is teaching me this. Well, I am partially on that, but still I should confess that I am not wonderful, but by seeing me, we all know that anyway. So, well, with this...
I had the pleasure of having Sladjana and her husband in Boston. I worked for Aramco. And Meridian's husband had also. I'd just like to say a few words. In the short time that we got to know Dr. Sladjana, it was really a pleasure to know her and her husband. And we basically fell in love with her. Because I was, like the gentleman was saying, my habit was also very much like eating meat, and I couldn't even think of not eating meat. Of course, my wife and my daughter, when my daughter was born, she had tendencies towards vegetables and greens and didn't like meat, and I was forcing her because I felt like she wasn't getting enough protein. And for me, the thing that broke the barrier was when Dr. Sladjana told me that you really don't need that much protein, and you can get a lot of that from the vegetables and raw vegetables. That made the point for me. And I just wanted to make that clear. The other thing is, the gentleman was saying, what choices do we have? Sometimes I go to the cafeteria, and I never noticed that section of the vegetables before. And I went directly for the chicken and the beef, and so now I've found that you really do have a choice. There's always that section of raw vegetables and fruits, and I found out that when I do eat that, I don't eat much, and I feel really full. So a little bit of the salad and the fruit and the vegetables does it for me. I just wanted to make a few points.
Thank you, sir. So Ram was the one who really brought us all together here, and then we should thank him for this, for giving an opportunity for us. I also should thank the doctor's husband, who has been a big support to the doctor all the time, and he is the success behind maybe I can say for this presentations all the time. I thank all the participants for having. In particular, we have requested our CEO of our GCCI to come here for this, and he has been kind enough to come here, and he was telling that he wanted to hear this and he wanted to get the use of that. So I hope more people will come to GCCI for the next week. So we are thankful for all the people, and before we conclude, I will request my DGM, Mr. CVC Rao, to give a small memento to the doctor as a token of our remembrance and grateful to us. I'm sorry.
Thank you for this nice gathering, and thanks to Dr. Sladjana, first of all, for our will to share our experiences in being a doctor, propagating not take medicines. This is one thing fantastic, okay? I am myself a diabetic, type 2. I got stented also recently. Doctors say because of stress and things like that. I am taking pills for blood pressure, cholesterol, all these things. But no, and basically I am a vegetarian. But now how to become raw vegetarian? That is the problem. Okay, we will try to do that also. And my wife is also somewhere here actually. I never wanted her to actually attend this function. Already she is very rigid on my diet. Now my life is going to be more miserable actually. But it is really enriching actually, this whole session. And you made it so simple. We are all worried, MD, how you going to explain how to sit for 2 hours here. Okay? But no, you made it so interesting, the whole thing. And you made the basics very clear for all of us. I think it is easy to follow, but difficult for all of you. Okay? Most of us, we are above 40, 50s here, undergoing a lot of stress. And this is a very nice session we had. And it's going to definitely improve our life. Okay? Thank you very much. And on behalf of all the people, and on behalf of NCC, I once again thank you for a nice presentation. And as a token of our appreciation, thank you all for making it a success. And special thanks to Mr. Timble, who is our motivator. and our great Umaka. Okay? He just follows the individual. Okay? For every kg you will get something special. Okay? And special thanks to Ratna for making the success. Thank you.
People can have some small coffee or tea or some snacks. Because we are at home, when we go back, we are going to have natural food. So let us try here.